What is MWA? What is microwave ablation for thyroid nodules?
Microwave provides electromagnetic waves that leads to heat, and the heat will generate energy that will cause necrosis, which means death of the cell. Patients who lose their thyroid, they can be very compliant, they can be taking their medication, they can have normal thyroid function tests and will never feel normal again. Clarify, you can use it, for example, in a very large nodule and provide efficient energy in a significantly shorter time.
Okay.
So for example, you literally can save 50% of the time in a significantly large nodule if you use microwave compared to radiofrequency ablation.
Perfect.
But in certain other cases, the nodule is extremely small and might not make a difference in time. Something about radiofrequency ablation and the utilization on vascular nodules is called the heat sink effect. The heat that is generated by the radiofrequency ablation will be absorbed by these blood vessels, by the blood running in the blood vessels in this nodule. And that effect is significantly diminished with microwave compared to radiofrequency ablation.
Welcome. We're sitting here with Dr. Emad Kandil at Tulane University in New Orleans, Louisiana. Dr. Kandil, welcome.
Welcome, Philip.
Yeah, and I'm Philip James. I'm from the Dr. Thyroid podcast. And today we're learning about microwave ablation. Ablation is treating thyroid nodules without surgery, correct?
Correct.
And a lot of patients have questions. A lot of health professionals have questions about microwave ablation or MWA. And we're going to clear those up today.
Let's do that.
Because some of it's misperceptions, right?
Absolutely.
That you're even hearing. So I have a list of questions here.
All right.
And I'm going to go down them with you.
All right.
And
Are you ready?
Looking forward to hearing your answers, okay?
All right. Are you ready?
Yeah, I am ready. I'm
right.
actually excited.
I was born ready. Let's do this.
Okay, let's start here. What is MWA? What is microwave ablation for thyroid nodules?
Microwave provides electromagnetic waves that leads to heat, and the heat will generate energy that will cause necrosis, which means death of the cells.
Very good. Okay, how about this? What to expect before the procedure? In other words, what to expect? A lot of patients think they're going in for a procedure at a hospital. Is it going to be painful? Should I get scared? Is there going to be error?
So patient needs to understand that this is a minimally invasive procedure. It's an outpatient procedure. Most patients, so if you ask patient about their pain level from 1 to 10, 10 is the worst, 1 is the least. On average, they say is approximately 3 out of 10.
What is the most common questions you get when you consult a patient before the procedure?
Well, many of these patients come out of town and they worry about, can I stay? Do I need to stay for many days? And I tell you, a lot of these patients will just fly in and out. And many of these patients can actually just go back to work. It's just
same day, next day?
Well, they can go back to work that afternoon. Honestly.
Same day?
Yeah, same day.
Pretty cool.
It's just a little bit, it can be done absolutely while the patient is fully awake, you're talking to them, and they just need to put a little ice afterwards and things are good.
Okay, Dr. Kandil, now we're talking about the procedure.
Yeah.
Walk us through it.
So
Show up at the hospital.
show up to the hospital or to the clinic. It's an outpatient procedure. Before we start the procedure, we like to put a little bit local anesthesia on the neck area, like a little cream. Sometimes we give the patient like just a little a tablet that make them feel calm and relaxed. They are fully awake. In my practice, I like to have a little bit of, alpha music kind of thing just to get people relaxed. I actually been thinking about doing the sound path right before.
Like sound bowls.
Yeah, sound bowls.
Yeah, I do that. Yeah, it's nice.
So, but the bottom line is you need to be really relaxed. The procedure can take just literally anywhere from few minutes to a maximum 20, 30 minutes, depending how big is the nodule. But in many cases, the procedure can be literally just like a 5-minute procedure.
Yeah.
And these patients, they just walk out and walk away and take care of themselves.
Man, so on the point of pain, it sounds less of an experience than going to the dentist. Less of a, you go to the dentist, it's typically painful. The guy to put the
Oh, tell me about it. It can be really pain, and I don't like the anesthesia. When I actually have some procedure, I would rather do it without any
Yeah.
anesthesia. Just, I'll take the pain, and I don't want to deal with the numbness and all this afterwards.
Dr. Kandil, there's a myth, I'm going to say myth, about microwave ablation being too hot. Can we address the too hot issue?
Well, ablation in general, with the radiofrequency ablation or microwave, they have the same idea of delivering thermal energy that will lead to the necrosis of the cells. And in both cases, if you are not very precise with the utilization of this technology, significant complications could happen. And the key is to really have the experience and the knowledge on the settings, on how much you need and how far do you need to be from vital structures, and to know the anatomy. These important details are essential to the success of the procedure. So for microwave, it provides definitely, it can provide more heat, but the key is to really know how to adjust the setting to really use it precisely without causing any problems.
So this whole concept of too hot, it really has more to do with a practitioner
Correct.
who doesn't know how to control it or doesn't know how to use the heat correctly.
Correct. Doesn't know the exact setting, how much can you use for either technology, and how close you should be or far from certain important vital structures in the neck area.
You know, I talk about this no matter what the topic. I have a thing where people tell on themselves. When people throw out that too hot thing, they're telling on themselves for not being informed. When a medical practitioner says MWA is too hot, they're telling on themselves for not being informed.
Absolutely. They just do not have the knowledge.
If you have a medical practitioner saying, oh, we don't like MWA, it's too hot, they just told on themselves for not being informed.
They don't know anything about it.
Okay,
That's
let's be clear on that,
this,
because it is a myth. We hear it, especially as ablation's relatively new, thyroid ablation to the U.S. And sometimes a doctor or a patient.
So to clarify, you can use it, for example, in a very large nodule and provide efficient energy in a significantly shorter time.
Okay.
So for example, you literally can save 50% of the time in a significantly large nodule if you use microwave compared to radiofrequency ablation.
Perfect.
But in certain other cases, the nodule is extremely small and might not make a difference in time.
Which segues to our next question. What type of thyroid nodules are best to be treated by MWA over RFA?
That's a very good question. So I definitely would prefer that for extremely larger nodules, because you can really make this significantly shorter procedure for the patient and provide significant outcome with providing enough energy that will cause necrosis of the cells. But more importantly, also with nodules that have some extreme internal vascularity, because in these cases, if you have too much blood vessels in the nodules, it's well known that RFA might have some, unfulfilling results. The nodule might not shrink very well, or might recur quickly because of the significant vessels and blood supply that keep breaking in. Something about radiofrequency ablation and the utilization on vascular nodules is called the heat sink effect. The heat that is generated by the radiofrequency ablation will be absorbed by these blood vessels, by the blood running in the blood vessels in this nodule. And that effect is significantly diminished with microwave compared to radiofrequency ablation.
Interesting. The benefits of doing MWA, doing microwave, over doing surgery for a thyroid nodule?
Well, I can maybe talk all day about the benefits, but first, you avoid general anesthesia. Second, you avoid any possible complication from the surgery. In the best hands, complications can be really extremely low, close to 0%. But you know what, Phillips? There is no complete 0%. And what we showed with research in the best hands across America, looking at over 100,000 thyroid surgeries done by high volume surgeons, etc., that if you in the same patient perform the same operation twice, meaning on both sides, you double the risk. by going to the other side. It's very well documented. So if you do things, the risk will just increase. So the bottom line is, also we as a surgeon, we look at complications, we say we did not injure the nerve, we did not injure the parathyroids, you don't have a complications. But patients can have other serious issues. Number one, if they lose their thyroid, it's a big problem. There is nothing like your own factory that secretes your own hormone inside you. Patients who lose their thyroid, they can be very compliant, they can be taking their medication, they can have normal thyroid function tests and will never feel normal again. And this is not uncommon. But also there's many other things. Research showed that after successful thyroid surgery with quote unquote no complications, many of these patients will have significant reports of having difficulty swallowing, neck discomfort, etc. Despite that there is no documentation of any complications. The surgeon is not lying, saying that there is no complication. The surgeon is honest about that. But if you have a questionnaire asking patients about how they feel after the surgery, it's really impressive how many of these patients are really complaining. Having said that, there are very happy patients too, and they have good outcome. And many patients also can have the surgery and have normal thyroid function and feeling good, but many others are not. So,
wow. You know what?
and the problem is one complication can be detrimental, like can really affect the quality of the life significantly. If you have an issue with the vocal cord, you are not going to be able to breathe well, you're not going to be able to exercise, it's just going to make life miserable.
100%.
Yeah.
Any risks we should talk about with microwave?
Well, with any ablation procedure, there are possible risks. Ablation can be done chemically by ethanol or thermal, by radiofrequency or microwave ablation. And again, precision and experience is an important key in the success of these procedures. But serious complications could happen. Injury to the trachea, injury to the esophagus, injury to the nerve, rupture, bleeding, infection, need for reoperation afterwards. I heard about crazy complications, but honestly, with experience, with precision, you can guarantee excellent outcome.
Great. I guess
more importantly, Felix, now this procedure is offered by many practitioners across the country and across the world. And it's fascinating and it's just shocking to know that many of the providers who are offering these procedures never adopted before like a biopsy practice. So they would never never did an ultrasound to look at the thyroid or do biopsies, and all of a sudden they're using these, like, in my opinion, they are very great inventions, but they can be dangerous weapons, and they're putting these in and doing it. So complications could happen, but also what could happen, failure of success of the procedures. So we treated many patients who had the procedure once or twice, but they never really had the appropriate treatment. It's what we call under-treatment.
Well, I guess on this note, kind of closing out this interview, we could probably talk to them again. For those watching, and if they have a thyroid nodule, they're probably very curious about microwave. And if so, how should they select a doctor? How can they find the best doctor for treatment?
I think it's very appropriate to ask your doctor how many you've done, and you ask them about their experience and ask them about kind of complication that they dealt with. It's your right to know as much as you can before getting this done.
Any final thoughts before we say farewell?
I think in general you need to be informed about your options. Sometimes surgery is the only option you have, but some other times you can have many other options, including ethanol ablation, including radiofrequency microwave, and definitely each option has its own indication, and you need to find the right person or the right provider that can advise you on the best option for you. A personalized approach for your case, not for everyone.
Thank you, Dr. Kandil.
Thank you.
And for those watching, we'll see you later.
Thank you.
Thanks.